I've been a member of Universal Single Payer Healthcare for some time. My first Universal Single Payer Healthcare meeting was 1972, November, and I'm still at it. In the election of 2004, there were several presidential candidates who spoke to the issue of national health care. The corporate media silenced these candidates by limiting their appearance on TV and talking process only when they did get airtime. When I hear the words healthcare associated only with working people, I wonder what their definition of a worker is. To me, it is many things. One is a worker who had a job yesterday and tomorrow is unemployed. Is that person no longer considered a worker? Is that person no longer in need of and deserving of health care? Oregon's biggest employer, Intel, is considering eliminating 15% of its workforce. Today, those folks are working. Tomorrow, what are they? Unemployed, and many without health care when the pink slip appears. We must have universal, single-payer health care. It is the only system we can afford. I do not think, and I do not believe that most Americans want insurance corporations to make the decision of whether or not a sick person can receive health care. If we have single-payer health care, not only is that decision removed from the insurance corporations, but also 25% profit out of every health care dollar is removed. The money is there. We need the political courage. I'm listening tonight and I hear Band-Aid solutions. I appeal to the folks here in the studio and to the viewers to support and work for single-payer health care. Many of the viewers know when Medicare came into being. I think it was 1965. And this is 41 years later? And who is insured in this country? The same people, the senior citizens. The idea of Medicare, when it was introduced, was to bring in everybody incrementally. We still have only one group insured. Maybe they should have insured the newborn babies, because after 20, 30 more years, then everybody would be insured in this country. So I want to thank Joanne Bowman. Max alluded to her speaking when she introduced our Universal Single Payer Health Plan Measure 23. She did a fantastic job when she introduced it. And I remember her closing remarks. Do you remember them, Joanne? She said, "If not now, when?" You remember, don't you? It's true tonight, folks. If not now, when? Universal Single Payer Health Care, it's the only system that works.